I wanted to give an example of what surgeons are looking for from 3D images of the shoulder. And I'm sorry if some of these images don't come out that clearly. I'm using 2mm slices to redo these, to reconstruct these in the 3D imaging. First, let me look at these images here on the right, which show the kinds of planes that we want to get, first of all with 2D MPRs. So we use the axial images to prescribe the coronal and sagittal planes, and you can see the green and blue lines represent the appropriate imaging planes for the sagittal images. You can see the blue planes, blue lines sliding back and forth. Surgeons really like to see this sort of contour of the glenoid surface, so something that's very parallel to the surface. And then this would be sort of the coronal plane to the shoulder. You can see the glenohumeral joint nicely in profile there. Okay, and you can see the green line scrolling through that. Anyway, what you can see on these axial images is there's this big defect in the bone. You may not recognize that, but that's called a Hill-Sachs deformity from an anterior shoulder dislocation. And you can actually see that here on the 3Ds, represented by this sort of defect in the back of the shoulder here. So when someone asks for a 3D, they might say, cut out the humerus and cut out the glenoid. Really, when they're looking at the humerus, you could remove the glenoid side, the scapular side, and really what they're trying to do is assess this bone defect. How big is it? How deep is it? Where is it located? Okay, and actually, I guess for the purposes of doing this, I may as well go ahead. Okay, so I've cut out the scapula, and this way, not quite gotten the whole thing, but this way they can get a clean look at the humeral head defect. Okay, and that's what they're looking for. They want to look at it from multiple projections. It's this defect here, and this is what we should be getting when we're doing volume rendering 3D images of the shoulder, especially on the humerus side. Now there's the other side as well. So now I've cut out the humerus, and we only have really the scapula in there. And what they want to see on this is this sort of en face, as they say, appearance, looking directly at the glenoid surface. And the reason for this is, along with the defect on the humerus, the Hill-Sachs deformity that we saw, sometimes you can get an injury to the anterior inferior part of the glenoid. In this case, the person already had some surgery there. But what they're really looking for is either a defect in there or a fracture fragment in that location. So when we get 3D volume rendered images of the shoulder and they're asking for the glenoid surface and cutting away the humerus, this is what they're looking for. They want the humerus out of the way so they can get a good look, particularly at this anterior inferior corner of the glenoid. Okay, and in different projections, you know, maybe going like this, and maybe looking from under here. Those are the sorts of things that they're looking for. It's not helpful if we keep the humerus in the way. I'll show you that in a second, why that doesn't help them. So here we have the humerus still in place, and as you can see, it's much more difficult to evaluate the glenoid margin because the humerus is blocking it. So this is what they're looking for when they get these 3D shoulder CTs. Basically, you want to separate the humerus from the scapula, look at the humerus from different projections, especially the humeral head, and look at the scapula from different projections, particularly the glenoid margin.